primary cause of death for African teenage girls is not malaria or HIV or any other disease. It's pregnancy, and every year there are over 2 million unintended pregnancies amongst teenage girls in sub-Saharan Africa, 5 times the number in Europe. More than 200,000 African women die, and many more experience infection, disease, and permanent disability from pregnancy-related causes. Most of these deaths are avoidable. Aside from the health consequences, teenage pregnancy results in the abandonment of school, lost career opportunities, and the stranglehold of poverty. Sharon is 18 years old and lives in Kenya.
I have 2 children. First one is 2 years old. The second one is 8 months old.
Sharon became pregnant when she was 15 years old, but she didn't know how she became pregnant.
No, I didn't know.
She was still going to school every day, but when she realized what was happening to her body, she decided to tell no one, and she split up with her boyfriend.
Yes, I told him that I don't want him now, and we left each other until I gave birth. And then he came to me and convinced me that he will take care of the child, so we should just continue to be friends, to be lovers. So I agreed again, and he gave me the other one also. I conceived again. My mother told me not to love the person. I should leave him because I'm still in school. Since I conceived again, and I told him that I don't want him.
Many young girls drop out of education permanently following pregnancy, but Sharon did go back to school, where she was able to join the educational program, The World Starts With Me.
Sharon, what did you see?
The World Starts With Me is a computer-based sex education program developed by Rutgers, WPF. It has been introduced here in Kenya and also in neighboring Uganda.
My boyfriend came and visited me at home, and then the boyfriend told me to escort him at his place to do some sex. Then I asked him that, do you have a condom? And he told me, let's go and buy. Then we went to the shop, there was no condom. Then we go to another shop, even there was no condom.
The lack of availability of contraceptives and their cost are major factors affecting the health of young men and women. Hajala's story here in Uganda is not uncommon, and she did get pregnant. She was 15 and has been caring for her blind and mentally handicapped child ever since. Inadequate knowledge about contraception and how to obtain health services and advice, sexual manipulation, a high risk of sexual violence, and poverty are some of the reasons why many teenage girls in Africa are especially vulnerable. Almost half of all adolescents in Uganda think that a woman cannot get pregnant the first time she has sex, or if she has sex standing up. Misconceptions that condoms cause cancer or infertility are common. Clinics such as this one can provide help and advice to girls and women, which is otherwise unavailable. Voluntary HIV testing, a quick and easy process which can give a result in around 15 minutes, can help the decision when choosing a contraception method. Jackie has been faithful to her boyfriend since she was 13 years old, and they have both tested HIV negative.
Other family planning methods that you can use. Which method would you prefer?
I would prefer the injector plan.
Are you comfortable?
Yeah.
You don't fear injection?
Adolescent childbearing carries particular risks. Young girls are often not physiologically mature, and those giving birth for the first time may lack essential information and have no access to health services and support.
You can hold.
Teresia in Tanzania was raped when she was 14. But that was only the beginning. Her labor went on for 3 days before anyone took her to the nearest hospital.
Umekuja kusema asubuhi. Hajasema si saa hiyo. Kwa maana bado mtoto hajafa.
Soon, Teresia noticed the unmistakable symptoms of fistula.
Ule baba ni ya operation. Asine bondara njango laga po pemera breki.
A fistula occurs when there is a hole between the vagina and the bladder, or the vagina and the rectal passage, or both. Physically immature girls are particularly prone to this condition following a prolonged labor. Often, neither the mother nor the child survives. The lucky ones, like Teresia, manage to get to a hospital where they can be surgically cured. There is another risk facing girls and young women in many parts of Africa: circumcision, or female genital mutilation, FGM. FGM involves the cutting away of the clitoris and parts of the labia. It has no medical benefits and many dangers.
I was circumcised because of the pressure from my friends. And my husband told me to be circumcised. He had a lot of pressure because he was advised by some elder men that that lady of yours is going to just produce girls until the end. He was advised that you just try to advise the other woman of yours to be circumcised, such that the hormones will change and she will have a baby boys.
Chibeti, who is now 25, was married when she was just 13 years old, here in Uganda. At 14, she gave birth to her first daughter. 2 more daughters followed in the next 2 years. And then at 17 years old, she was circumcised. After her circumcision, Chibeti became pregnant again with yet another girl. Her husband rejected her, and she and her children had to leave the family home.
Why did he again blame me for having only girls, and yet I was not God who made them?
Chibeti and her daughters now live with her mother. She is unlikely to find another husband. The chances of survival from pregnancy for a mother in Africa are many times smaller than in industrialized countries, such as those in Northern Europe. For every 100,000 births in Europe, around 6 women will die. In countries in sub-Saharan Africa, up to 2,000 will die. Education and the availability of contraceptives will do a great deal to ensure the survival of these women and the future of their communities.